In some somber news that is coming in from Karnataka, the highest number of COVID-19 cases that has been ever reported in Karnataka has come to light. 196 cases of COVID-19 reported in a single day. Number of cases in Karnataka rises to 1,939. 72 COVID-19 cases reported from Yadgir in a single day. 39 COVID-19 cases reported from Raichur. 20 COVID-19 cases reported from Chikbalapura, 15 COVID-19 cases reported from Gadag, 4 COVID-19 cases reported from Bengaluru urban. Death toll in Karnataka due to COVID-19 at 42. This is the big news coming in. For more on this, I'm also joined in by my colleague Ashish. So Ashish, going ahead and looking at this entire scenario, definitely the scenario is very grim for Raichur and Yadgir especially. And also looking at it, the Maha crisis is haunting Karnataka again and again. Yesterday we saw that the total number of cases from Karnataka linking to Maharashtra had gone up to 523. And today an additional cases of over 100 has been added now. Somewhere, despite the fact that the land borders has been sealed and locked for Karnataka, mainly in the Belagavi region as well as the Vijaypur region, you still have more and more number of people who are coming in from Maharashtra who have registered on the Seva Sindhu app. And now we are looking at least another 50,000 people who will be coming in from Maharashtra towards Karnataka, and all of them are migrant laborers. How will the state government of Karnataka go on and handle this entire situation? Definitely seems like it's quite a grim scenario out there.
Well, absolutely, Prajwal. The situation getting out of hand does not really seem to be an overstatement at this moment, because of the fact that we are reporting numbers such as these. 196 cases in a single day in Karnataka, absolutely unprecedented. And in fact, we were talking about how Karnataka has been, battling the COVID-19 pandemic over the past few months, and, it has made sure that its number do not really cross the double figure mark even over the, just a few weeks ago. But now you are seeing 196 cases in a single day, and this is the highest ever spike as far as Karnataka is concerned. Now let's break up these numbers and let's take a look at what exactly is the scenario, where are the cases from, and how many cases have been reported from different districts. Now all of these 196 cases have been reported from across 15 districts, and this is a massive jump from 138 cases that were reported from 21 districts yesterday. So clearly, day by day, there is a clear increase in the number of cases. Speaking about the capital city, Bengaluru, 4 cases have been reported from Bengaluru, including one 4-month-old baby. Now this is a very curious case. This particular case, I'm singling it out because the family of this baby had traveled to Delhi 3 months back, and the family came back from Delhi. They tested themselves for COVID-19. Everyone from the family tested negative, but this 4-month-old baby itself has tested positive, while everyone else from the family has tested negative for COVID-19. So where did the baby get the COVID-19 from? Where did they get the coronavirus from? That remains a mystery at this point in time. Looking at other districts across, across the state. Before going to that, let me also speak about one particular case from Bengaluru that has now, come to light. That is of patient number 1815. Now, this particular patient is a police constable. It's a police officer who had been posted in Tipu Nagar's Anandpura slum. This man was posted there. This police officer was posted there on duty because, obviously, remember, Tipu Nagar was one of the earliest containment zones in Bengaluru, and there was a slew of cases that was reported from that particular constituency, and there was a massive deployment of security forces. There was a bit of clash between police officers and also people staying over there. They were trying to convince them to come to hospitals for treatment. Amidst all of this, the one person has tested positive, and this is a cop who has tested positive from Chamrajpete. Moving on to other districts across the state, Yadgir has reported 72 cases, and all of these cases, like you have been calling it, the Maha bomb explosion that has taken place in Karnataka, all 72 cases from Yadgir have been reported, from people who have traveled back from Maharashtra. Apart from that, Chikbalapura has reported 20 cases, and this includes a lot of young children who have tested positive today. And this is one pattern that we are looking at, a lot of young kids who have tested positive. Even the case that I was talking about in Bengaluru, the baby has tested positive, and even in Chikbalapura, a lot of young kids have tested positive for COVID-19. Apart from that, looking at other districts, you have 4 cases from Hassan, you have 3 cases from Dakshin Kannada, 3 from Davangere, 2 from Uttar Kannada. Kolar, you have 2 cases. Udupi, you have 6 cases. You have 1 case from Dharwad, Udupi, Belgavi, Kalburgi, and also at the same time you have 15 cases from Gadag. So clearly, 15 districts have reported cases, positive cases today, and the total amount, the total tally is going up to 196, which brings the total tally in the states to 1,939, which is a massive number given the fact that just a few weeks back we were lauding the Karnataka government and speaking about how the authorities have been able to contain the COVID-19 virus, and how the lockdown has been made effective in the state, and how it has ensured that everyone in the state is safe and healthy. But now that you have all of these cases coming in, and especially because of the fact that there has been interstate travel, when did this travel happen? When did people actually travel from one state to another while there was nationwide lockdown in place? On one hand, we had people talking about how stepping out of the house apart from essential work was prohibited, and how everyone was following it. On the other hand, you have all of these cases coming in, bringing about a big question mark as to when did these people travel to Maharashtra. The borders were sealed, no one was being allowed to step out of their houses even. So where did these people travel? How did they travel? What is the mode of transport? Is this a criminal negligence on the part of authorities, or are some people involved in facilitating all of these transports? All of these questions will have to be asked now, but clearly the primary focus remains on the rising number of cases in the state, which now has risen up to 196, most of which have come from interstate travels, especially from Maharashtra.